That's the type of thing that should stay in place. We always should have had the capacity for patients in the community at any point in time to connect to one of our caregivers, whatever day a week, whatever hour of a day. We've built a 24-hour, 7-day-a-week behavioral health response center. So when people feel they're in greatest need, greatest risk, greatest vulnerability, we should have a capacity for people to reach out and speak to a behavioral health professional. We've leveraged our digital health platform and used telehealth and video health in a level beyond what we could have imagined. Having nearly 180,000 people now have their physical examinations, their physician office visits done over a digital health platform. We've created a whole new company, a testing company. And our testing company now has 122 full-time staff members in it, and we're operating 9 permanent testing sites, from Mystic to Westport to Torrington to Enfield, everything in between, as well as 5 mobile testing units that each day go out into our communities, to nursing homes, homeless shelters, community centers, in our setting up shops in church parking lots and anywhere else where we can reach our communities, and particularly our communities who are most vulnerable and in greatest need. We've moved, this organization had to adjust our practices, right? We've moved from an unprecedented moment from having to restrict visitation to now we're standing back up visitation within this organization. But as we bring back visitation, we have to do it more safely. And we have to have social distancing built within it. We have to change our practices on how we room and onboard patients and bring visitors into our facilities, where and how we allow people to congregate in our facilities. We had to change all of our practices around ways that we clean different aspects of the facilities. So we've made very significant changes, and most importantly, we've now built predictive modeling with MIT, and that predictive modeling helps us around planning and response to not only what we know today, but what we are anticipating in the future, so that we can map our personal protective equipment, we can map our ventilators, we can map our critical care nurses, our physicians who do airway management, and critical care physicians, to ensure that we have the right people in the right place, whether we needed them in Eastern Connecticut or Southern Connecticut, so that we could be responding to the needs that were greatest. So I'm really pleased today to be welcoming into this discussion Dr. Fiona Murray. And Dr. Fiona Murray, Fiona is a worldwide respected expert, international leader in innovation. She's the Associate Dean for Innovation at MIT. And MIT has been an outstanding partner to us. We've had a partnership with MIT for more than 5 years. And MIT has played a significant role supporting our efforts in innovation. But Fiona has started to lead a national discussion around crisis innovation, and about the very nature of the case study that we can examine within Hartford Healthcare about how this crisis stimulated innovation and ultimately is going to allow us, in fact, to be better than normal. But the risks, the challenges, the imperatives around crisis innovation, this will be an entirely new level of focus, research, and understanding. And MIT, and specifically Dr. Fiona Murray, is on the very lead in the world around this discussion. And she's been a remarkably dedicated, loyal, committed partner to us at Hartford Healthcare, has provided extensive guidance and advice to senior members of our team. And I'm really delighted to welcome Dr. Fiona Murray and to allow you the opportunity to speak with her and hear this really emerging area of innovation that will be critical to healthcare in all responses as it relates to this particular pandemic and any other event of significant magnitude. So Fiona, please, thank you so much for joining us. And I'm also going to invite momentarily Dr. Barry Stein, who is the Hartford Healthcare Chief of Clinical Innovation, also to come forward and give more further commentary and discussion around the types of innovation that we are doing and really how much of it was stimulated in this partnership that we enjoy and take advantage of with MIT. So Fiona, please.
Okay. Well, Jeff, thank you very much. I too and MIT absolutely value this partnership with Hartford Healthcare. It's really been a very important part of our journey for thinking about how large, complex organizations delivering really important on really important missions such as healthcare actually need to innovate, need to actually use innovation to drive what they're doing. And it's always been a special privilege and pleasure to come down to Hartford from Boston and work with you. Your team, I think, has shown an extraordinary willingness, even prior to this moment of crisis, to really embrace innovation as a core set of activities and very critical to delivering your mission. And so I very much also appreciated experiencing your leadership in that. As you know, we think about innovation as taking ideas from inception all the way to impact. And so I think that's an important piece of this, because this isn't just people being creative, having aha moments, or being sort of eureka geniuses. This is about having ideas from all over your organization, but really being able to drive them through so that they have impact on patients, on the community, and on the healthcare outcomes that are so important. And so for me, it's a key activity that sometimes we don't always associate with health systems, but I think you've demonstrated how valuable it is. You asked me to say a few things about crisis innovation, and in fact your definition is you are living this every day. We think about this as innovation in a time of great stress. And so we often associate that with times of war, great recessions, natural disasters. As you said, it's innovation out of necessity, right? People talk about necessity being the mother of invention. And what I think we're seeing is absolutely organizations that had already laid the groundwork, who have the leadership, really being able to actually take their existing innovation practices and then absolutely amplify them for this crisis time. And you gave us some fantastic examples. We really do see that it's organizations that can drive this common purpose. And as you have in your leadership and with your team, talked about, the focus and the urgency is what seems to really make a difference here. In some ways, it's almost easier because we know what we need to focus on. It's not that the problems are incredibly hard, but there's a focus and an urgency that I think is key. And then there's a connected community. So we've also seen that organizations who have laid the groundwork for having trusted relationships with people all over the organization and out into the community with different stakeholders are really ones who I think are doing better in this. Because we get many more people putting their ideas forward. This is not just a small number of people or just the leadership. It's bottom up, many different contributions. And then I think the third piece, which I think is also key, is committed capacity. So the fact that you're able to move your resources in very, very rapidly to make testing available, to make all your labs available for certain things. As you said, the 24-hour test center, optimizing the use of beds, all the kind of modeling that MIT can help with in the background is about making that capacity really committed to this particular goal. And so those to us seem to be the three key characteristics.
Fiona, let's just give one example. We got a request several weeks ago from one of the largest corporations in Connecticut, a Fortune 100 company, who said that as they were thinking about their challenges globally, but they're headquartered in Connecticut, they said, we need a chief medical officer. And we feel we're missing that perspective at the table as they're making major decisions within the organization. And we asked them what their needs were specifically. We had a dialogue. By the end of the day, we appointed a chief medical officer at that company. That solved the very immediate need in terms of giving them kind of that resource. But what we've now learned from that process a month or so later, there is such untapped potential between a major employer who's looking to enhance the health, wellness, safety of their environment, the well-being of their environment, enhance the services they're offering, the benefits they're offering. Now that we have a member of our team serving as an interim chief medical officer in that company, the innovation that's starting to develop as a result of this kind of cohabitation that we've created, the synergies, are massive. And there are so many examples where we look at things we're doing now and we said, why weren't we doing these previously? And I look at the things we've done around our colleague support center. And we've created, a service now that is available to any one of our staff who can reach into this colleague support center and get support around, presently it's been around hotel services, child care services, identifying other things that allow them to perform their role within our organization. And we said, we always had the capacity to do that. And I think the most important area is around health disparities. But there's such a need to do better and to do more. And we are finding, as a result of this, as you point out, this sense of necessity, that we're now providing more accessible care closer to home with partners, trusted partners within different communities, and we're already seeing we're able to make a very big difference, and we're going to be able to build on top of that very significantly. So what you're saying resonates completely with our experience, here within our organization.
And I think you mentioned telemedicine and having done, I think you said 180,000 visits already with telehealth. I think that we had a debate in this country about trying to do this for a decade, and yet all of a sudden, because it became a necessity and not just a nice to have, many of the barriers I think we cut through. We recognize when we have a common purpose, we can really commit to doing things. And I think we've seen that not just in Hartford. I work with a group who are actually based in Cairo, who've suddenly been able to sort of transform some of the medical access in a country like that where it's absolutely essential right now.
Right.
So things that were nice to have become essential, and we find we can mobilize with great speed because of the leadership and focus.
It's interesting, Fiona, you give the example of Cairo, but I'll tell you, even here in Connecticut, we have certain subspecialty services that wouldn't have been available in some of our rural communities that we have hospitals and provide services to. Through this telehealth now, we have real-time, extended hours access to consultations with these very kind of hard to access specialties that have now become really very accessible. So these types of breakthrough innovations have enormous impact, and you can imagine globally that could change healthcare around the world at so many different levels. But even here in our home state, we're seeing that type of benefit.
And I'm so glad, because I think especially here at the moment, thinking about health disparities is obviously top of mind for many of us. And some of the things that, as you say, you're seeing access over much longer periods, making these specialties accessible to people in rural communities or people for whom getting to the hospital is just so challenging. It's really turning our innovation engine towards those problems, but with that sense of commitment and urgency, and with trusted community relationships. So I think we've definitely seen, and I've seen, that it is that connected community that makes a huge difference. And having laid that groundwork, over the previous years, you have those trust-based relationships to be able to deliver in a way that you might not have done if you hadn't really made those investments in those relationships.
Absolutely. And I think critical to this whole discussion is about being a learning organization, about constantly learning, reassessing, being willing to take some degree of calculated risk as we try to make, major impact. But as a learning organization, to constantly be reassessing, what's working, what can we do differently, what can we do better, and how do we make certain that we can make improvements. And Fiona, let me introduce Dr. Barry Stein, someone you know well, a former student of yours, and a close working partner. Dr. Stein is our Chief Clinical Innovation Officer, and I'd like Barry to speak to, again, more of the specific examples of the way innovation is really transforming what we're doing within our health system, but specifically how it relates to this crisis and how it helps our community most, and how it makes a difference for all the people we serve. So Barry, please let me introduce you into the conversation with Fiona.
Thanks, Jeff, and thank you, Fiona, for joining us. We're really thrilled and honored to have you here, and as a key partner along the journey, we feel very privileged, and on behalf of our entire organization, want to express our gratitude. When I listen to the conversation that you and Jeff were having about innovation, it reminds me about how important the innovation ecosystem, the ground, the fertile ground to do such extraordinary innovation activities, and to be able to translate them at such extraordinary velocity, the velocity that Jeff spoke about in the last 10 weeks. And some of the examples that we've already touched upon, but were particularly important along the journey, was all the work we had done around predictive and prescriptive analytics and the next generation advanced analytics that we brought in from MIT, that we were able to apply in a very focused way to solve a really desperate problem in helping us understand the surge of COVID patients and how to manage capacity in the ICU and with ventilators. And it was all related to that connected community that you spoke about, the focus and purpose that you speak about, as well as Jeff, and our capacity to resource this. So as I was listening to you and Jeff talking about some of the remaining gaps that we still have to focus upon. The health inequities concern us significantly. As we've innovated rapidly, we're very mindful of the digital divide being amplified and the health inequities actually getting bigger and bigger. And would love your thoughts around how you believe we could potentially mitigate those gaps with an innovation ecosystem such as ours, and the ecosystem at large with startups and entrepreneurs trying to solve those gaps.
Yeah, absolutely. Thank you, Barry. And it's, as always, a pleasure to talk to you and be a partner in the innovation activities that you're doing at Hartford Healthcare. I think this point about the innovation ecosystem, which is, again, that sort of set of key stakeholders who have these really different sets of expertise and ideas that they want to bring to bear, is incredibly important. So when we talk about that, as you know, we think about the entrepreneurs, we think about the investors, we think about the large corporations. And obviously there are a number of those in Hartford who are absolutely critical to the fabric of the city and the wider region. But also the really important role that the government plays and the universities. And so I think a lot of what really helps us move forward with some of these projects and to really drive innovation at the kind of velocity that we're talking about is having that ability to bring in entrepreneurs with new ideas quite quickly into the system, whether that be companies who are focused on things like pill packs, right? So online, being able to order all your medication and so on and so forth. Whether it's also engaging with small companies in the region who can actually turn their production lines at the moment to PPEs and what have you. I think with respect to the digital divide, I think that we might say the easy answer is to ask the government to basically provide and upgrade infrastructure for the entire community. And in the long run, we know that's an incredibly important thing to do. I think in the short run, what we're going to see is startup entrepreneurs and others really coming up with some of the ways in which we get to compress all the data that we need to share, find apps that we can use on our phones, so that hospitals and medical providers can really take advantage of some of those opportunities. Thinking about ways in which we can gather data and share it back to the hospital, and frankly build a very distributed network to be able to help us with access. And then I think we also have to do some low-tech things, which is we might not be able to access the main hospital, but perhaps there are opportunities to come into community centres to be able to have an intermediate location to be able to access online health and telehealth and so on. I think you're right that ultimately, because so much, including education as well as health, is really moving to this online world, it really is going to be our access to that is going to be a massive driver of inequality if we have unequal access. Interestingly, again, and I do a lot of work, as you know, around the world, we are increasingly seeing the private sector try to come and solve some of these problems. And we see that especially in the Middle East and Africa, where the government really isn't going to solve the problems, stepping up and entrepreneurs trying all kinds of different solutions. And we may well end up, I think, with a world of multiple solutions, but as a large healthcare provider, your job is going to be quite challenging to integrate all those things together to provide the kind of online health experience that you need to provide.
So Fiona, thank you so much. And before I hand you over to Jeff, just want to thank you again. I always refer to you as a gift that keeps on giving to our organization and to myself personally, and appreciate yours as well as Dr. Phil Budden, one of your colleagues, support and ongoing ambassadorship. Jeff?
Thank you, Barry.
To me, when I think about the discussion today, what I'm so encouraged by and so proud of is all the people who are working within our organization. I look at the fact that we've eliminated waiting rooms, and we're having now, in many instances, people be texted so that we're not having people congregate, in our physician offices. I look at the fact that staff members have created clear plexiglass shields as opposed to using masks in some instances so that patients can see their eyes and can see their facial expressions and have more trust. I look at the fact that we were able to, when ventilators were in their greatest jeopardy in terms of not having enough capacity to care for people, the way we created split-level capabilities to share ventilators across patients should that need have ever arisen. And I look at the fact that the way we were able to build adjunct hospitals on our campuses with just moments' notice and create 1,000 new beds within the system. That's the type of innovation that we need. That's what's going to make us better. And I can only hope and expect that we're going to keep the spirit of innovation driving us forward, because it creates better access, more affordability, higher quality for the care for this community. And that's the ambition of the system. And it's what thinking differently, more broadly, more courageously will help us do. So Fiona, thank you so much. And I'll ask for any questions to Dr. Murray or any questions I can answer at all on any matter.
Hi, good morning. It's Bridget Risman of the Republican American. Question for Fiona. You raised the issue of the digital divide, which seems to be the greatest barrier to all of this. And I could use myself as an example. I live in a town that will not have high-speed internet for another year to a year and a half. And despite all of the private sector efforts, it's just simply too expensive. There isn't enough profit margin. So it's completely unrealistic to have a universal access to this network.
No, I mean, look, you make it's a very, very important point that you make, and I think that there are always going to be parts of our community where, where the private sector can't solve all the problems. I think we have to make sure that we create the right incentives for people to develop the right sorts of solutions. And again, the ingenuity of coming up with solutions that are actually not as costly. There is some fascinating work going on about having internet access sort of via very high, up in the air hot air balloons. I mean, crazy ideas at some level, but at the end of the day, it is something that I think we need the government to step in and provide the right incentive structure so that this sort of thing happens. Because as you described, when we don't have access, it really does create, it's a different version of creative haves and have-nots. And so I think that this really does highlight an important point, and that something like healthcare isn't just something that happens when we show up at the doctor's surgery in a very physical way. I think the extraordinary opportunity around telehealth is greater access, but that is mediated, as you say, by digital accessibility. Happily, I think increasingly phones and cell phones will help us. And there are going to be solutions that really are to do with, all the ingenuity that Jeff was talking about, being able to try and make this something that doesn't require, the most high-end digital access, because otherwise we absolutely fall into the traps that you're describing.
And thank you. And that will take quite a bit of time, I assume.
I think it'll take time, although frankly, I think it takes focus. I mean, as Jeff pointed out, right, one of the things that is extraordinary about innovation in these crisis innovation is that we get this sense of focus and urgency. And that makes it much easier for us to deploy resources, to have the shared commitment and capacity. I think if we deployed the same effort around the digital divide challenge, we would probably see some solutions reasonably quickly. It's about this ability to craft an agreement around common purpose that is what makes crisis innovation both exhausting but also extraordinary in what we're able to do.
Thank you.
Additional questions?
Lisa Carberg at News 8. I'd like to ask Fiona, I see the modeling is pushed out to mid-August, and I'd like to know if you see any of these protests or demonstrations affecting that within this time frame. Talk about that, please.
Of course. So, as you know, my colleagues at MIT, who are a group of extraordinarily expert data analytics and modeling science folks, are the ones who are really driving some of that. And as with all these models, right, they're only as good as the information that you put into them. And so again, the investment that one of the reasons we love working with Hartford Healthcare is because of their real commitment to provide as much data and information as they possibly can. And as Jeff says, take that information and actually learn from it, which we can use to then update our models. You're always going to have massive sources of unpredictability, things that you could never have predicted that are really going to shape what we think is likely to happen over the coming months. And I think obviously the demonstrations and what have you, and the reduced social distancing will surely have an impact on that, and the things that we could not have predicted. But now we know that this is happening. Clearly, we have to update our models. We will probably know in the next few weeks, and I'm sure hospitals like Hartford will see whether or not we're beginning to see additional spikes. I'm not sure we have that information yet, but as soon as we do, we'll be able to use that to then update our predictions. And that will be something that will obviously be fed in back into the hospital and how they're optimizing and managing the resources.
Correct. Very good. If there are no other questions, again, we thank you very much, Fiona, for joining us, and thank everyone for your time and attention today. Thank you.
Thank you.